I'm glad to be here today. One of the things we've changed is how we support I call it the health IT ecosystem going into 2010. In prior years, we've had varying degrees of good success supporting federal clients like the VA, the Military Health Service, private providers like Tenet and Kaiser Permanente. But we looked at all the changing things going on in the market, whether it be ERA funding, new standards for privacy and security and such. And corporate management made the decision we need to verticalize this inside the company.
Right.
So we've created a separate group within a public sector group here in D.C. to work at it, the whole ecosystem, working with the military standards body, the government standards bodies, the providers such as VA and MHS, the bill payers such as Social Security and CMS, and extend that down to the private providers as well, because as national standards continue to be set and national funding is applied, you really need to look at this market horizontally and vertically at the same time and bring a cohesive model to play.
Right.
So again, protecting security end-to-end and privacy end-to-end, no matter where the data starts or where it ends up. Cost curve, as you've heard, it's not sustainable, the current market as well. So one thing, think transportability. If you're an individual person in the private industry, your health record is not largely transportable, which gives you limited ability to shop for the best services in terms of quality and cost. So if you can automate this, make it interoperable, make it secure, make it transportable, you have a better choice of doctors going forward. And efficiency. Got some interesting statistics that are a few years dated in terms of investment. And investment in IT breeds efficiencies downstream. The U.S., on a per capita basis, this is 2005 numbers, we invest approximately 50 cents per capita per year in health IT. Great Britain, on the other hand, is $200 per person per year. And then Australia is about $5 and Canada is about $32. So like most other sectors of the economy, when you invest in IT, they've seen great productivity gains and quality gains in the last 10 years. Health IT has been lagging, so a lot of the investments coming through the HITECH Act are really going to be catalysts, I think, for additional bending of the cost curve in the out years. Are associated just with the sheer size and complexity of the health IT, I call it the ecosystem here in the United States. Health is 15% of GDP. I would argue that's also the Fort Knox of PII, personally identifiable information.
Right.
So the people are looking to use that information for bad purposes are probably licking their chops to a certain extent now, because a lot more information is going to come online that needs to be protected as well. And you've got an extremely complex ecosystem. You've got the individual consumer who you want to empower, get as much information, as much access as possible. There are multiple doctors out there. There are multiple healthcare delivery organizations behind that, state and local governments, bill payers, and the federal government. That creates a lot of seams in the process. So unless you have standards, as we all talked about, but I would also argue you need a lot of training for the operators, for the consumers, for the providers, because this is all new to them. So you're going to have to train them, and there's going to be some cultural changes that need to take place, because the end goal we all are aspiring to is you want confidentiality, i.e. only the people who need to see your record can see it. Integrity, what they see is authoritative. It's not old. It's not old records 3 years out as well. Then once you put everything online, it's got to be available. People are going to get rid of the paper copies. So if you're in a critical medical situation, you're going to need immediate access no matter where you are to that record. Then on the backside, you have a lot of compliance issues on the back end. You have HIPAA, you have ERA. So you need to build all that together in a way that, again, goes back to bending the cost curve. You have to apply all this and bend the cost curve. So I think that's the challenge, is to increase security, increase privacy, interoperability, while cutting costs at the same time. Best practices from the public sector can be extended into the private sector as well. And again, a lot of the standards work that's going on at ONC and other places, and NIST as well. Again, we're not starting from scratch here. We have some good work we can leverage as we take this wider across the economy. Courses to get to the verticalization piece, and what we've seen since then, and actually before then as well, is a tremendous impact in a couple of different areas. Number one, we've talked about the standards. Everybody realizes that these standards, the end goal is to break down the silos, to make the whole system more efficient and help the individual pieces of the system become more efficient and effective. So tearing down the silos, that's been an impact. Obviously the funding, the resources, there's $20 billion that's going to start to be reimbursable here very shortly as well. People are looking at that as a catalyst to help them invest in terms of automation if they haven't done so before. And then the other side, we haven't talked about it a lot, there's some very strict penalties out there for data breach that are embedded in ERA, which people are using to help justify investments in privacy and security, because they know what the cost is if they don't do it and they suffer a breach as well. So what's happened, so this is forced the whole ecosystem to start paying higher degree of attention to this, and they've looked at McAfee. We've come in as a trusted advisor in this area to help them navigate. We're not telling them how to get, the government and other folks are talking about the end goal. We're giving them some best practice to help them get there more effectively and more efficiently. I think we're heading in the right direction. Time will tell how effectively and how quickly we get there. But I think we're going to move to a model where things become more automated, more available to the users. As I mentioned before, you're going to have more choice as a consumer because things are going to be interoperable and transportable. And I think we're going to move to a place where, as a company, you're going to be able to see the cost curve start to get bended a little bit as well. And I think this new ecosystem is going to provide additional capabilities in terms of risk management. You're going to be able to see, not only as a consumer in a business, you're going to be able to make choices of where your information goes, how it goes. You're going to have some assurance built into the process as well, so you'll have confidence in the system that this information, you're going to permit it to flow different places as well. And this is going to be pretty non-invasive. As the identity, the other initiative we mentioned here, as that gains legs, as this continues to mature as well, I think you're going to see a system where medical records individually can flow more easily, which I think is going to shape cost and quality improvements. And I think you're also going to learn things at the public health perspective as well. You're going to do some macro modeling against the records as well to try to nip trends in the bud, such as H1N1. You're going to do a much better job of monitoring public health because everything's going to be automated. You're going to be able to non-attribute individual PII information, but roll the statistical data up to see where the outbreak patterns perhaps may be as well. Again, it's going to be optimistic that we need to get there. We will get there, but also a little bit of caution because it is a very complex ecosystem, and it's also 15% of the economy. That's not going to turn on a dime. But I think reading the direction that's coming out of the federal government, I'm confident we're headed down the right path.